Welcome to Facilitating Academic Success in Undergraduate Nursing Students. My name is Sarah Bonner, and I've been a registered nurse since 2004. While I have loved each role that I have had in my nursing career, teaching has by far been my favorite. I'm in the final phase of my master's degree in nursing education. I'm currently employed as the clinical coordinator at a state university in upstate New York. In the 3 years that I've been at this college, I've witnessed a large number of students who are academically unable to progress through the third semester in the associate degree nursing program. After interviewing students and faculty, high attrition rates were unanimously determined to be directly related to underdeveloped critical thinking abilities and problem-solving skills that impaired their test-taking abilities. In an attempt to help the students in my program, I decided to begin researching how to improve retention during the particularly challenging period between the first and second year in the ADN program. Researchers found that having an exam average less than 76% increases the risk for attrition. The SUNY college where I work has a progression requirement of 74.49%, which rounds to 75%, in order to continue on to the next semester. And looking at cohorts, 6 of them between spring of 15 and fall of 17, data revealed that 25% of students had a testing average below 74.49% at the end of the second semester. That number increases to 40% by the end of the third semester. To address issues of retention, the literature suggests a multi-pronged approach. In response, I devised a 6-module WebQuest. In an attempt to improve critical thinking and test-taking strategies as standards increase within the nursing program, the WebQuest offers various interventions aimed at promoting success. For example, the module topics included time management techniques, study skills, and learning style assessment. Researchers have identified positive outcomes when educators develop interventions such as those that encourage effective integration and application of knowledge, test-taking strategies, and measures to decrease test anxiety and improve confidence. The column on the left side includes the index for the WebQuest, while the area in the white is the component of the Welcome tab. This information is found in the Process section and provides an explanation to students of what to expect as they move through the WebQuest. Included in the WebQuest modules are several opportunities for students to perform self-assessments. For example, a time management self-quiz was included to help students identify if they're budgeting their time wisely. This type of assessment inevitably leads to reflection. Evidence supports reflection as a strategy that promotes critical thinking, enhances reasoning skills, and encourages self-reflection in nursing students. Students often don't recognize assessment quizzes as reflection activities, therefore their results may be more authentic. This slide is an example of a reflection exercise from Module 2, which is focusing on test-taking strategies. And this exercise in particular asks students to stop and focus on the different sensations and feelings that they were experiencing before their last test, asks them to reflect on how they prepared, were they able to think clearly. I would encourage you to pause the presentation and take a look at this slide so you can understand what the reflection activity looks like. There are 4 primary stakeholders for this WebQuest. First and foremost are the students themselves. The vast majority of students have invested time, money, and effort into their education, and they should and can expect to receive the appropriate level of training and knowledge to be successful in the role of a professional nurse. At the same time, students have a responsibility to ask for and accept help when it's needed. Students who are unsuccessful in their academics have been found to have a loss of confidence in their ability to master skills and knowledge, as well as an increased level of frustration. So a cascade of events may occur when the students are unable to progress, including increased length of time in school, increased cost for the student, and high attrition rate. Attrition rate not only affects the student body, but the institution itself is exposed to widespread repercussions. Also impacting that is the use of the cohort model, which presents a unique challenge in nursing education. So when a student fails a course, their spot in the program is typically left unfilled within that cohort, contributing to the high cost of nursing education. It's imperative for nursing education to begin employing the most cost-effective strategies and using qualified educators with the students who need them the most. Nursing education has a responsibility to foster a learning environment in which academic success is readily achievable. When faculty members are aware of the students who are deficient in skills or knowledge, they need to be proactive in getting the students the help they need before their grades reach a point where they can't be redeemed. Contemporary teaching strategies such as online education must be implemented to meet the needs of today's learner. In addition, nursing schools can aid in student success by providing tutoring resources. Implementing this WebQuest will help to ensure that these students are adequately prepared for entry-level practice as future nurses. Research confirms that nursing programs who have incorporated remediation courses such as this that address topics such as how to alleviate test anxiety, learning how to read NCLEX-style questions, learning test-taking strategies, have considerably higher success rates. The consequences of increased attrition also impact the academic reputation of the school and program, and repercussions include low enrollment and loss of revenue. Unfortunately, some programs respond by lowering the standards for progression from one course to the next or for graduation requirements. Students are able to progress without having completed the required skills or the knowledge base. Research has found that patient safety is jeopardized when academically unprepared nurses are providing care. The impact on healthcare recipients and the community at large must be addressed. Not only are patients and residents at risk for receiving substandard care, but a severe shortage in qualified nursing staff is on the horizon. The impact of the nursing shortage will be felt on both the local and the national levels, if it hasn't already been. The theoretical framework of this project was based on Malcolm Knowles' adult learning theory. The term andragogy was introduced by Knowles as a reference to the difference in the way that adults learn and can be described as student-centered, experience-based, problem-oriented, and requires collaboration between adult learners and educators. According to Billings and Halstead, adults are persons who do best when asked to use their experience and apply new knowledge to solve real-life problems. Online learning is largely driven by the principle of andragogy. Online learning accounts for differences in time, place, and pace of learning, along with variations in individual style. The integration of past and current experiences have the potential to enhance the quality of learning that takes place for the adult learner. In order for online learning to be effective, the learner must be self-motivated and continually engaged. In addition to the concept of andragogy, the theory of self-regulated learning is in alignment with this course. According to Maas, self-regulated learning focuses on the metacognitive aspects of learning, as related to the degree to which learners participate in managing, self-monitoring, and self-evaluation of their learning. The very nature of online learning rests in self-regulated learning and is what attracts many students initially. Online learning allows students to complete the work at their pace and the times which are most conducive to their individual needs. In order to confirm the relevance for the development of this project, data collection was needed. Interviews were conducted among students in their second, third, and fourth semesters in the ADN program to assess the level of interest in the concept. The third semester faculty was interviewed to help identify areas of concern among students. In addition, a review of data took place to determine test scores and attrition rates during the same semesters. All data revealed that an intervention is needed to facilitate academic success in nursing students as they transition between the second and third semesters. After justification of the project was established, various strategies were employed throughout the creation of the WebQuest to ensure best practices were referenced and student engagement was possible. Nursing educators are charged with tremendous responsibilities. It is the responsibility of nursing educators to ensure strong, independent, analytical, and reflective thinkers that are the driving force behind the profession. With this responsibility comes the gift of opportunity. nursing educators have been given the opportunity to foster a spirit of respect and collaboration. Adult education presents a platform on which to capitalize on the unique qualities and experiences that each student brings to the group. There is a definite shift in the role of the faculty from imparter of information to facilitator of learning and guide to knowledge. There is also a shift in the demand for online learning, which is on the rise. This means that nursing faculty will have to adapt to the different approaches to online education, including new ways to engage students in collaboration and problem solving. After the justification for the project was established, various strategies were employed throughout the creation of the WebQuest to ensure that best practices were referenced and student engagement was possible. Many hours were spent researching the concepts that are included in the WebQuest, such as test-taking strategies and critical thinking skills. Each module contains resources that are presented in myriad ways. For example, there are videos, Powtoons, Animotos. Literature suggests that employing various activities in this manner engages the adult learner, not only in their learning, but in higher order thinking skills that are essential in nursing. Additional research was also conducted to validate the inclusion of the specific content in the WebQuest. So for example, Module 6 addresses learning styles of the student. Understanding the preferred learning style is helpful for students as they are expected to process and analyze increasingly complex information. Research also recognizes that the physical, emotional, and academic implications of anxiety are high. It's been found that high levels of anxiety can have negative consequences like the inability to concentrate during study sessions, misreading questions, changing the answer, blanking out, physical symptoms, even. And so for this reason, there's a module within the WebQuest that's devoted to stress management. To evaluate the effectiveness of the WebQuest, 3 criteria were developed. These criteria can be adequately assessed when the WebQuest has been in use for a minimum of 1 full semester. The criteria include 1. Test averages of 90% of all second-year nursing students will be above the 75% mark within 2 semesters of implementation. 2. Students will demonstrate a 25% or greater improvement in scores between the pre-module exam and post-module exam. 3. Students will each verbalize 1 strategy to reduce test anxiety after the presentation. The first outcome requires time to assess. In order to have sufficient data to confirm or deny the effectiveness of the WebQuest in improving test averages, several cohorts of students should be assessed. The first cohort to receive the full benefit will be the students who are currently completing the second semester in the ADN program. So they will have access to the WebQuest for the fall of 2018 semester. Exam results from their final 2 semesters will be collected and analyzed to identify any improvements in test averages at the end of each semester. A similar study of 11 at-risk third semester nursing students were offered participation in a remediation program and found to have significant improvements in academic success by graduation. So although student success is dependent on multiple variables, such data provides promise for some similar results with the implementation of this WebQuest. The second outcome can be measured by assessing the pre- and post-module exams after the cohort have completed the modules in their entirety. Only after participation in each module should the students be taking the post-module exam to ensure that the results are accurate. For this reason, collecting results to determine whether the outcome was achieved will also take time. The third outcome is able to be measured after the presentation of the WebQuest at the start of the semester. Students will have 2 opportunities to share effective and ineffective strategies for managing stress and anxiety. The first opportunity is within the WebQuest. Here, students are asked to reflect on what makes the stress of nursing school worth it for them, and that's in Module 3, and it's a private reflection. Reflection has been found to be useful in nursing education for its association with the development of critical thinking skills and enhanced thought processes. Also, the faculty has the opportunity to assess students' understanding of available stress-relieving measures during an in-class discussion at the beginning of the third semester. So by this time, students have had time to fully participate in and reflect on the WebQuest, and the classroom setting offers an opportunity to hold an open forum for faculty and students to share ideas and perspectives. So a learning environment where students are genuinely valued and encouraged can create the ideal environment for building critical thinking skills. The WebQuest modules, which include topics such as stress management, study skills, test-taking strategies, they've all been determined to be essential in facilitating the academic success of these students. So the development of these skills, along with critical thinking abilities and problem-solving skills, will provide students with the tools necessary to complete the ADN program and pass the NCLEX RN. So as students complete the WebQuest and gain these tools, higher numbers of graduates will enter the profession. So not only will there be an increase in the number of registered nurses, but those nurses will have the capacity to deliver high quality care to their patients. The institution will see an improvement in their reputation, enrollment increases, and everyone wins. Students are often ill-prepared for the degree of complexity that's required for problem solving and critically analyzing the content as they transition between the freshman and senior levels of the ADN program. So an opportunity like this WebQuest improves the ability for these future nurses to develop those skills that are required to provide high-quality nursing care. There are a variety of concerns involved with nurses who are underprepared in their knowledge and skills. When students consistently have poor academic performance, they're likely to experience decreased self-esteem. And research has found that students who perform poorly on classroom exams also have decreased confidence levels. The problem is that students who have poor self-esteem or lack confidence are less likely to seek help from faculty. When students who are struggling don't receive the necessary help to facilitate their success, they will likely not be successful. The result is fewer students graduating from nursing programs who are eligible to take the state boards, thus perpetuating the cycle of high attrition rates, fewer nurses, and increasing the nursing shortage. Unfortunately, some programs have responded to these concerns by lowering their requirements for admission to the program or for progressing from one semester to the next. Students who progress through the academic program despite failing to fully develop or improve their critical thinking skills and problem-solving abilities pose a risk to the populations that they will someday serve. The combination of decreased confidence and insufficient knowledge base often leads to difficulties such as a lack of patient care and attention, unprofessional or unethical conduct, the inability to recognize and report changes in patient conditions, and failure to seek help when needed. The development of this WebQuest was a very rewarding experience. In my current position, I spend time working one-on-one with students to review study tips and test-taking strategies. And for years, I wanted to develop a course that would benefit students who are entering the second year of the ADN program. Because I work with many third semester students who are failing, the problem is many of them wait until it's too late in the semester to get help. So the challenge for me was to find a way to offer up this information in the form of a course, but not being able to call it a course for a few reasons, primarily due to financial aid restrictions that prohibit students from taking a course that's not required. So I had to find a way around that barrier. And then there's the challenge of how do you motivate students to take a quote-unquote course in which there's no grade assigned and it's not mandatory. So as a solution, I developed the online tool in the form of a WebQuest to provide a large number of resources covering a broad range of topics. Each module contains a variety of information that has been intentionally selected and oftentimes carefully constructed from the beginning. The online format affords students the opportunity to access the information at their convenience. A benefit to the WebQuest format is the ability to add or remove content as needed. This allows for adaptations to the content to best match the students' needs, and it also permits the test bank to be revised and continually provide students with the opportunities to practice their skills. As we know, research is continually changing the way we practice in healthcare and in education, and by updating the WebQuest periodically, we're demonstrating to the students that we value evidence-based practice and value lifelong learning, and it is my hope that the students recognize the importance of both and can integrate these two concepts into their own practice. So facilitating the academic success of undergraduate nursing students as they transition from the second to the third semester of the ADN program is paramount in addressing the needs of multiple stakeholders. Students may not recognize areas of deficiency in their own academic abilities. Presenting a WebQuest that advances skills and knowledge in areas such as test-taking strategies and critical thinking abilities will afford the students the opportunity to increase their chances for success. Having skilled and knowledgeable nurses entering the profession will benefit many stakeholders in the healthcare arena. Student participation in the facilitating academic success in undergraduate nursing education WebQuest provides students with the opportunity to advance their problem-solving abilities and critical thinking skills to successfully complete the ADN program. Thank you for your time and attention.